The social work profession is one of the only professions that doesn't have a specialized medical program for medical social workers. There might be a handful in the United States, but of those programs, when I searched for them, they really didn't offer a specialized medical social work tract that really helped you understand the role as a healthcare social worker in any medical setting. And as medical social workers, we don't learn any medical terminology in social work school. And we learn little, if anything, about healthcare insurance. Part of our job as medical social workers is to be able to read medical charts and understand medical terminology so that we can best help our patients. But social work school didn't teach me any of that, and I'm assuming that it probably didn't teach you much of that either. In this video, I'm going to be giving you 4 tips on how to master medical terminology without a medical degree. My name is Tabby, and I'm an LCSW with over 13 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and real-world experience. So why is it even helpful to learn medical terminology as a social worker? Well, we have to be able to read our patient charts, and we have to be able to understand what their diagnosis is. We have to be able to understand the procedures that they're going through, what their treatment needs are, what the treatment plan is, and we have to be able to formulate a discharge plan and identify potential barriers, because it is much easier to coordinate care when you know what to expect. For example, you might have a patient that gets admitted with COPD exacerbation. COPD stands for chronic obstructive pulmonary disease. And key factors to understand about that would be knowing that it's a lung disease and understanding the treatments that go along with the lung disease. For example, that patient might need supplemental oxygen, they might need medication changes, new medications, or they might need a nebulizer machine. Other factors to think about might be maybe they have difficulty with ambulation, so they might need physical therapy or an occupational therapist to evaluate them to determine if they need equipment at home, certain equipment at home, or if they need home health care. They also might be a smoker, and so understanding that part of it means maybe they need to have a cessation program, so giving them information on that. Let's talk about understanding medical terminology. It's easier to understand medical terms when you can understand the basics of the language. So medical terminology is based in Greek and Latin language. Latin medical terminology can have up to 3 parts to the word. First, we have the prefix, which is a group of letters that's before the root word. Then we have the root word, which actually provides the primary and basic meaning of the word. And then we have the suffix, which is the group of letters after the root word. So for example, let's take osteoarthritis. Osteoarthritis means the wear and tear of degeneration of a joint cartilage. So if we look at it, we look at the prefix, which is osteo, and that means bone. We look at arthur, A-R-T-H-R, which actually means joint. And then we have itis, that means inflammation. Another example we can look at is hysterectomy, which is a surgical procedure to remove the uterus. So if we look at the prefix, we have hyster, and then we also have the main word, which is ectomy, and that means removal. Because there are a lot of these different suffixes, root words, and prefixes, you can actually download a medical terminology cheat sheet that I've created using the link in the description below. I know that this can be really overwhelming as there are a lot of medical terms, a lot of words, and you don't have to understand all of these terms, but it is helpful to learn and understand as much as possible. To help you speed up that process, here are those 4 tips to help you to learn medical terminology without a medical degree. Tip number 1, print out that cheat sheet or create your own cheat sheet of the most common medical terms and abbreviations. Keep that sheet with you. You can put it either in a notebook or a binder. You can tape it to the back of a clipboard, which is what I used to do. Just keep it with you. So as you're reading the medical chart, you're looking through the history and physical and progress notes, and you have that cheat sheet with you so you can look up those words and understand as you're reading. Tip number 2, notice and write down abbreviations and terms that come up repeatedly when you are reading a progress note or through multiple charts. Add it to your cheat sheet list if it's not already there. Make sure to write it down repeatedly because your brain will make the association with that word much more quickly when we write it down repetitively. Tip number 3, Google it. Google has been my best friend throughout my career. Use Google to look up those words and terminology. Use it to look at videos of certain procedures and about diagnoses that maybe you don't understand. That helped me out a lot. Google's your best friend. Use that to your advantage. Tip number 4 is to ask. Ask your peers, ask members of the interdisciplinary team that you work with about different terms or diagnoses that you don't understand. They likely will be happy to assist you and to explain things to you. I don't think anybody's going to shame you for not knowing medical terminology. And remember, we did not go to school and learn medical terminology. Despite what everybody believes and thinks, we didn't. So give yourself a break. Ask your peers, don't be afraid. You might learn more from them than you expect. And I personally have found that asking the physicians and pharmacists and nurses that I work with about certain terms really actually helped strengthen our bond and develop a stronger professional relationship.
Guys, high-fiving?
There you have it. Those are 4 tips to help accelerate your knowledge in medical terminology. I wish you luck on that. If you liked this video, please like and subscribe. Hit the notification bell to get notified when new videos come up. Also, make sure to check out the Social Work Mastery newsletter so you can sign up to get tips, tricks, and resources to help you become a more efficient medical social worker.